Hi, my name is Captain Dr. Zachary Teo, and I am a Search and Rescue Medical Officer from 1 Medical Squadron. Welcome to today's episode of What's in My Bag, Search and Rescue Medical Officer Edition. For search and rescue missions, we typically bring 6 items on board the helicopter. So our first item is the oxygen box, and it contains oxygen tanks as well as masks for oxygen delivery. This here is a back valve mask, which we can use to administer oxygen as well as rescue breathing to the patient in times of emergency. This next bag is an automated CPR machine. So we have a machine that is capable of delivering high quality CPR at a rate of 100 to 120 compressions per minute. In this machine, we also have a video laryngoscope. This will help us to put down a breathing tube for the patient in case they are unable to breathe on their own. This is an intraosseous drill. It is for us to administer fluids to the patient via the bones if they are unconscious and we are unable to set an IV line on them. Next up, we have the search and rescue MO wall. So this wall is a tactical wall with many pouches, and it contains many of the equipment that are critical and essential to our search and rescue mission. First off, we have the miscellaneous pouch, which contains additional PPE. It also contains a search and rescue guidebook for the MO and medic to refer to in flight when they need access to the information. There's also a C-collar, a cervical collar, which helps us in the stabilization of the neck in the case of any cervical spine injuries. Next up, we have our airway compartment, whereby we have equipment such as intubation equipment to secure a patient's airway if they cannot breathe or maintain their own airway. We also have a hardware compartment whereby we have tacticalized headlamps as well as flashlights in order to help us to see better during austere environments or night flying missions. At the back of this wall, we also have additional equipment such as burn dressings in case we encounter patients who are involved in chemical or blast explosions and have sustained burn injuries to themselves. This is our suction bag. Inside we have a suction device as well as the suction tip and the connection tubing. This will help us to clear the patient's mouth from any secretions that may cause him to accidentally choke. We also have PPE inside this bag, so we have eye protection, we have N95 masks, and we also have surgical gowns and gloves. So this is to protect our search and rescue operators from any risk of contacting COVID. Inside this bag, we also have a pack of fluids that is pre-primed for us to administer quickly and easily to the patient once he's on board the helicopter. Next up, we have this machine, which is our monitor and defibrillator. This helps us to monitor our patient's vital signs as well as to deliver shocks in the event of cardiac collapse. This is our BP cuff as well as our pulse oximeter, which help us to measure the patient's blood pressure as well as oxygen level. We also have a 12-lead ECG set in order to check on the patient's heart rhythms in the event of any suspected heart attack. Inside here, we also have defibrillator pedals, which will help us to deliver shock to the patient if he is in any kind of cardiac collapse. Last but not least, we have our droplet pouch. This droplet pouch is worn by our search and rescue MO and medic, and it gives them plenty of equipment that they can access easily to do a variety of procedures. First up, we have a glucometer. This glucometer allows us to check the patient's blood glucose levels within a matter of 1 or 2 minutes. We also have a portable pulse oximeter, which can help us to check the patient's oxygen levels. Here is an IV set. This allows us to set an IV line on the patient and administer fluids to them quickly. We also have a chest seal in the event of any traumatic gunshot wounds or any injuries to the chest, which will cause the patient difficulty of breathing. Here we have some tourniquets as well as some dressings in case the patient is bleeding profusely and we need to stop the bleeding. In addition to our medical equipment, the search and rescue medical team also carries on board life support and survival equipment, which are critical to our safety and mission success. So first off, we have the helmet. This helmet is used by the medical officer as he winches down from the helicopter, and is also equipped with a comm set so that we can maintain communications with the aircraft captain during the mission. Next up, we have the waist safety belt. This waist safety belt is worn around our waist and allows the medical team to move around the aircraft cabin freely as we're administering treatment and managing the casualty in flight. And finally, we have the Life Preserver Unit, or LPU for short. The LPU is worn by all aircrew as part of all missions as it is critical for safety in the event of any emergency ditching scenarios or any other emergency. So there you have it, guys. These are all the equipment that the search and rescue medical team will bring on board for every single mission. Between myself and my search and rescue medic, it's about 60 kg of equipment, and that's about 30 kg of equipment per person to carry on board every single mission. Hope that this has given you some insight into what we do as search and rescue medical officers. And thank you for watching this episode of What's in My Bag.